Hey everyone, welcome back to another session. Today is a little different. We have Krish, he's a fourth year dental student, and he'll be presenting and showing us the Immersify Education app, which I believe is a great resource for all you pre-dental students out there. And whenever you're ready, you can take it away, Krish.
So, hi everyone, thanks for joining in today. Thanks for the introduction. So yeah, my name's Krish. I'm a fourth year dental student at Newcastle University in the UK. And I also work closely with Immersify Education as a champion and a dental content creator. So today I'm going to spend a little bit of time talking to you about dental charting. So by the end of this short talk, you should know what dental charting is. You should know why dental charting is so important, be able to talk about the different types of dental charting, and hopefully be able to take a chart on one of your patients. So, what is dental charting? Dental charting is defined as the process by which a dental care professional lists and describes the hard tissues present in a patient's oral cavity. But what does that actually mean? Let's take a look at these photographs. This is one of my patients from Newcastle Dental Hospital. As you can see, there's a lot going on here. We've got lots of different types of restorations, fractured teeth, and missing teeth. Trying to describe all of this to the patient, a dentist, or a nurse would probably take me the best part of an hour. So that's the first use of dental charting. It's an easy and succinct way of describing the current state of the dentition. The next use is for medical records. Charting the teeth records the presence of health and disease in the mouth. Recording all of these details allows you to compare pre- and post-treatment charts. It's also hugely important for medico-legal protection reasons to know exactly which teeth are present and any pathology present before starting treatment. Dental charting is also universal, which means that any clinician anywhere in the world can pick up one of my charts, for example, and know exactly what's going on in the patient's mouth. This is great for when you need to refer one of your patients to a specialist, or even just want to show the case to a dentist for a second opinion. The final use is for forensics. Because of the fact that there's 32 teeth in the mouth, which can be present, missing, restored, decayed, crowned, partially erupted, and a whole host of other things, all of this together makes an individual's dentition almost as unique as a thumbprint. This is incredibly useful for the police if they find a body that's unidentifiable, say for example because of a house fire. A forensic dentist can then chart the teeth and compare this to the records from local dental practices to try and identify the body. So let's move on to look at the different types of dental charting. We first need a way to identify the teeth that we're talking about and identify each individual tooth. Say for example, I'm taking a chart of a patient's teeth. If I just say, oh, that tooth over there has caries, that tooth is a crown, and so on, my nurse isn't going to have a clue which tooth I'm talking about. Therefore, we need a way to identify each individual tooth. And actually, there's three ways of doing that. We've got Palmer notation, FDI notation, and universal notation. And it's really, really important that you can differentiate between them because you don't want to get into a situation where you're mixing up the teeth. So let's look at Palmer notation first. This method of notation was created by Dr. Croydon Palmer in Ohio in the late 1800s and is the system most commonly used in the UK. The first thing to understand is that the mouth is a big place and there's a lot going on. So to make things easier, we divide the mouth up into 4 quadrants. In the Palmer notation, these quadrants are labeled upper right, upper left, lower right, and lower left. The reason I put the labels for the upper right and lower right on the left-hand side of the image is because we label the mouth as it would be in the patient. So the right side of the patient's mouth is the left side as we look at this picture. Then, to identify each individual tooth, the teeth in each quadrant are numbered from 1 to 8, starting at the front of the mouth and working our way backwards. 1 and 2 are the incisors, 3 is the canine, 4 and 5 are the premolars, and 6, 7, and 8 are the molars. If we look at the whole mouth, this is how the teeth are numbered. The diagram on the left shows a mouth if it was opened out, and all of the teeth are numbered from 1 to 8 in each quadrant. And then this diagram on the right shows the exact same thing, but the images of the teeth have been removed. So to name each tooth, we just have to put the 2 parts together, the quadrant and the number. For example, this tooth here is the sixth tooth in the upper left quadrant, so it's called the upper left 6. The lines around the tooth show which quadrant it belongs to. This is just a quick and easy way of writing out which tooth you're talking about. So this tooth here is the third tooth in the lower right quadrant, so it's the lower right 3. And here's another couple of examples. This is the upper right 1, and this is the lower left 4. However, this only shows the adult dentition. For children, we use the exact same quadrant names, but instead of numbers for the teeth, we use letters from A to E. A and B are the primary incisors, C is the primary canine, and D and E are the primary molars. The teeth are described in exactly the same way. So this is called the upper right E, and this is called the lower left B, and so on. Moving on now to the FDI notation. This is the World Dental Federation notation, which was adopted by the World Health Organization and the International Association of Dental Research. Again, the mouth is split into 4 quadrants. However, with FDI, they're named slightly differently. Now they're called 1, 2, 3, and 4. 1 shows the upper right quadrant, 2 the upper left, 3 the lower left, and 4 the lower right. The teeth, however, are numbered in the exact same way, numbers from 1 to 8 in each quadrant, the same way as Palmer notation. And then to get the name for each tooth, we just put the 2 parts together again. So if we look at the same 4 teeth as before, this tooth here, which was the upper left 6 in Palmer notation, is now called 2-6 in FDI notation. The lower right canine is now called 4-3. The upper right central incisor is called 1-1. And the lower left first premolar is called 3-4. Again, this only shows the adult dentition. The primary dentition is slightly different with FDI. Instead of using letters like the Palmer notation, the FDI system still uses numbers, but just relabels the quadrants. So the quadrants are now called 5, 6, 7, and 8. And these diagrams show what each individual tooth would be called. And finally, the universal notation, which is sometimes called the American notation system. This notation system is probably the easiest of all to remember. Here, you don't need to divide the mouth into quadrants. The teeth are numbered from 1 to 32, starting with the upper right third molar and going clockwise around the mouth. And then, looking at the primary teeth in the universal system, this system changes to letters for the primary dentition, like the Palmer system, but starts with A and goes right the way around to T, starting with the upper right and going clockwise around the mouth. This slide shows a really nice summary of the 3 different types of notation. And as I mentioned before, it's so important that you can differentiate between the types and know which system you're working in. For example, if you just said tooth 24, you could be talking about the upper left first premolar in the FDI system, or the lower left first incisor in the universal system. Now imagine receiving a referral letter asking you to extract a tooth. If you didn't know which system the dentist was working in, you might end up with a bit of a problem. So now that we've covered how to identify and name all of the different teeth, we can move on to charting. Unfortunately, it's not enough to say the upper right 6 has caries or the lower left 2 has a composite restoration. We have to be a little bit more specific than that. We have to record where on the tooth the decay or the filling is. We do that by dividing up the teeth into different sections. So this diagram is a template of a dental chart in the Palmer notation. The right and left sides are labeled on, as well as the quadrants in the corner of the image. Each of the squares represents a single tooth. As you can see, each square has some dotted lines in it, which further subdivide the tooth. The squares that represent anterior teeth are slightly different from the squares that represent posterior teeth. And that's because the anterior teeth have an incisal edge, whereas the posterior teeth have a full occlusal surface. So, naming the different surfaces. Buccal means towards the cheek. Labial means towards the lips. Palatal means towards the roof of the mouth, and obviously that only applies in maxillary teeth. Lingual means towards the tongue, and of course that only applies to mandibular teeth. Occlusal is the biting surfaces of posterior teeth. Mesial means towards the center of the mouth, or towards the midline, and distal means towards the back of the mouth, or away from the midline. I've put the names of each tooth surface on these diagrams, but it's important to remember that the names of some of these surfaces change depending on which quadrant we're looking at. So this slide shows the floor quadrants and the two different types of squares used for dental charting. And I've added the labels on for each of the individual segments. The most important thing to remember is the changes in position of the mesial and distal side, depending on which side of the mouth we're talking about. Just remember that mesial means towards the midline of the mouth, and distal, of course, means away from the midline. So now that we know all the surfaces of the teeth, we can move on to how to chart all the different intraoral findings. So if we start with the easiest finding to chart, and that is a tooth with no restorations and no decay. And to chart that, you just leave the square empty. The next finding we're going to chart is missing teeth. If you see a tooth that's missing, put a line through the square. You chart restorations by drawing out and colouring in the surfaces. The restoration is present on. So this restoration here shows a restoration that spans the occlusal and interproximal surfaces. Cavities are charted in a similar way. However, instead of shading them, they're left unshaded. Again, the circle should cover all of the surfaces that the cavity covers intraorally. So this example here shows a simple occlusal cavity. Now, if you spot a restoration that looks like there's some evidence of marginal leaking or ditching, you chart the restoration, but then draw an outline around it showing that the restoration needs replacing. The fracture of the tooth is charted as a hashtag symbol. When charting these, make sure you position the symbol over the part of the tooth that is fractured. There are some other findings that are really easily charted by simply writing a letter or letters on the squares. For example, a crown is charted as CR, a veneer with the letter V, a bridge abutment is BA, bridge pontic is BP, a partially erupted tooth is noted PE, and a fissure sealant is noted FS. And there's plenty of other weird and wonderful things that you might find in your patient's mouth when charting. So here's a QR code that takes you to a fantastic PDF and goes through how to chart all different intraoral findings. So now we've covered how to name the teeth. We've covered the different surfaces of the teeth, and we've covered how to chart many of the common dental findings. So if we put all that together, we now know how to perfectly chart a patient's dentition. So what do you need to chart a patient's dentition? The first thing is good lighting, then a dental mirror and a probe, and finally a 3-in-1 or a cotton wool roll to dry the teeth. And it's so important to dry the teeth before you start charting, because light can refract off wet surfaces of the tooth and distort your vision. So here's some tips for dental charting. Make sure you start in a logical place. You need to make sure that you don't miss anything out when you take a chart. So try and avoid starting in the middle of the dentition. Personally, I always start with the upper right 8 and then work all the way around the upper arch and then move on to the lower arch. The second tip is to make sure you use your mirror and look at each individual surface of every single tooth. And this leads really nicely onto the last tip, which is ensuring you look at the distal surfaces of posterior teeth, especially the last standing molar. It's so common and it's so easy to miss caries on the distal surfaces of upper 7s and 8s. And from a medical legal standpoint, you really don't want to be missing any disease in the mouth. When you first start charting, take your time. It really doesn't matter if you take 10 or even 15 minutes to fully chart a patient's teeth. It matters more that you can make an accurate representation and an accurate recording of the patient's teeth. So, take a look at this chart. At first glance, it looks really, really confusing. There's so much going on here with circles, letters, shading everywhere. But with some time and some practice, you'll be able to chart this and read it off really, really easily. The more you practice taking a chart of your patients, the easier it will become and the faster you'll be able to do it. And that's where Immersify Education comes in. One of the amazing features of the Immersify Dental app is a tool called Chartistry. Immersify uses augmented reality technology to create a virtual learning environment. Looking through your phone, you can see the head of a patient and use a dental mirror to chart all of the intraoral findings. It's easy to use and allows you to practice your charting from the comfort of your own home to prepare you for seeing your patients. So, this is a short video that I've screen recorded on my phone while using the Chartistry tool. This is the Chartistry homepage, where you can see a short tutorial on how to play the game and see the leaderboard. When you press play, the game loads up. The pop-up that appears on the screen allows you to choose which charting system you'd like to practice in. You can choose between Palmer, Universal, and FDI. I've chosen Palmer because that's the system I use on my own patients. You can also see what the different intraoral findings will look like in the game. Composites, cavities, different types of crowns. When you press play, you get to position the head. In this video, I'm playing the game in my bedroom. You can adjust the height of the head to be more comfortable for you. When you're happy, you can press to toggle the mirror and start having a look around to see what you can find. The tooth icon in the top left-hand corner shows you how many intraoral findings there are. The heart shows you how many lives you have left, and the gold disc shows you your score. When you find something that you need to chart, press the center button at the bottom of the screen to bring up the chart. Choose the tooth and select what you found. Then continue looking around the mouth and keep doing this to find all of the things that you need to chart. When you finish, press Submit Chart, and the app automatically marks your chart, telling you which teeth you got right, which ones you got wrong, and shows you exactly anything that you've missed. The great thing about this is that you can then go back to the patient and see which teeth you've missed. So here, I've missed the lower right one, and I can go back to the patient and take a look. And then, as long as you haven't used up all of your lives, you can move on to the next chart. Make sure you guys download the Immersify Dental app and have a go at the Chartistry game and see if you can beat the high score. So thanks so much for listening, guys. I know I've completely overloaded you with a lot of information in a really short space of time. But if you've got any questions, feel free to email me or drop me a message on Instagram. I'm more than happy to help you guys out. Thanks for listening.
Thank you so much, Krish, for that amazing presentation. I think it's an amazing tool that we can use to kind of get better at something that we'll be doing in the future. So if you guys have questions, you can drop them in the chat or email Krish. And if that's it, thank you everyone for watching, and you can always use this video